When a child care provider reaches out to Johnson County Mental Health Center to learn how we might be able to help a child who is struggling, it's because they love the child and they care about them very deeply. They see them every day and they're really wanting them to be successful. So they're wanting to learn more about how they can help them. It would be appropriate for a child care provider or caregiver to connect a family to services when they're noticing that the behavior of concern is becoming pretty prevalent in the child's day-to-day functioning and is starting to interfere with their ability to be successful. If a child care provider is wanting to connect a family to services, there's really only a few pieces of information that you need to know. You can connect a family to our phone number to call to ask about services before they come in, or they can look at the website that provides more information about accessing services as well. If a family is ready to come in, you can direct them to utilize our open access process, which is available in our Olathe and Shawnee locations. The hours for that start at 9 a.m. and it's offered Monday through Friday. There is no appointment required for our open access. It is just a walk-in process. The child will need to be present for the intake assessment, and then the family will also need to provide a photo ID, a proof of insurance, proof of income, and proof of Johnson County residency. During that intake assessment, they will meet with a qualified mental health professional, and based on that assessment, they will either be referred to a provider within the mental health center or to a community provider. If they are connected to a provider within the mental health center, the clinician will discuss with them what different services we offer and what might be most appropriate for them at this time. If the child is referred to an outside provider for services, we do try to connect them to those services before the family leaves the intake appointment. This process can feel very overwhelming for families. When they come in, they're usually already feeling like they're in crisis and struggling to know the best way to manage the concerns around their child. So if they have any questions, there are always people available to help, whether that be there at the mental health center or they can always call to ask questions they might have before coming in. There are so many child care providers in Johnson County that may not realize all of the services that we offer that can be extremely helpful for a child and a family who may be struggling. So it's really important for them to know how to connect a family to services so they can provide education about those resources and ways that we can be helpful.